Usually when we talk about a medical diagnosis, there's this expectation of precision.
Right. Like it's very cut and dry.
Yeah, exactly. It feels like engineering. Like
Uh-huh.
you break your arm, the X-ray shows that jagged white line in the bone, and the doctor just points at the screen and says, well, there it is. That's the problem.
It's highly binary. I
And-
mean, it's either broken or it's not broken.
Right. And it's comforting. We like things to be visible, to be easily categorized, and to just have a straightforward fix.
Oh, definitely.
But then you step into the world of chronic inflammatory skin conditions, and suddenly that X-ray machine is just, utterly useless. We're looking at a diagnostic landscape that is, quite honestly, murky.
It is the absolute definition of diagnostic muddy waters.
Yeah.
Because it requires looking way past the surface to understand what's actually happening on a cellular level.
Exactly. So today, we are taking this massive stack of clinical guidelines, dermatology conference notes, patient education materials, and our mission for you is highly specific.
Very specific.
We are extracting the ultimate guide to this highly effective yet surprisingly simple treatment protocol. It's known as the soak and smear technique.
Right.
And we're looking at this specifically for managing a really challenging, often misunderstood skin condition called lichen sclerosus, or LLS.
And, what makes this deep dive so essential for you is that it completely flips our usual expectations of modern medicine on their head.
Oh, absolutely.
We are going to arm you with actionable, scientifically backed steps to basically turn a frustrating chronic condition into something manageable. And the most compelling part,
Yeah, this is the best part.
right, is that you can achieve this simply by changing the physical mechanics of your evening routine.
Which is the ultimate hook for me, honestly, because in modern medicine, we are constantly obsessed with finding the absolute newest, most high-tech, genetically targeted drug.
We always want a new pill.
You just want a pill.
Yeah.
But looking through these sources, the evidence proves that how you apply a medication can actually make it up to 100 times more effective.
100 times. It's wild.
It's not a new drug. It's just a profoundly different physical approach to putting it on.
It is a massive shift in perspective, really. It proves it's not always about the tool you have in your hand, but how well you understand the environment you're using it in.
Okay, so let's unpack this, because before we can even talk about this soak and smear technique, you really need to understand the battlefield.
Mm-hmm. The terrain, so to speak.
Right. We need to look at the very unique physical barrier this technique is trying to penetrate. So, lichen sclerosus is essentially an immune misfire.
Exactly.
Your body's immune system just gets confused. It stops recognizing a specific protein in your skin as being part of you, and it attacks it like a foreign invader.
But the crucial detail here is the location.
Yes.
This protein isn't on the surface. It is located in the very, very bottom layer of your skin tissue.
Right, the stratum basal, or what dermatologists in the sources often just call the basement layer.
The basement, yeah.
And one of the patient education sources uses this incredibly vivid analogy that just perfectly visualizes the problem. They compare this condition to a busted water pipe in the basement of an apartment building.
I love that analogy. It's so accurate.
Right. The damage, like the actual fire, the inflammation, is starting deep, deep underground. But eventually, if it's left unchecked, it floods the upper floors.
And that visible flooding on the upper floors, that represents the symptoms a patient actually experiences day to day.
The stuff they can see.
Exactly.
Yeah.
Because that inflammation in the basement layer is so intense and so chronic, it fundamentally alters the architecture of the skin above it as it pushes upward.
It changes the whole structure.
It really does. The top layers of the skin, the epidermis, they respond to this deep trauma by thickening defensively. So the skin loses its elasticity.
Okay.
It can tear easily, it becomes sticky, and it develops this highly characteristic, crinkly appearance that dermatologists describe as looking like wax paper.
Wax paper, right. And we should be really clear here, this is not just a cosmetic issue. The physical changes are incredibly disruptive.
Oh, not at all cosmetic. I mean, lichen sclerosus most commonly affects the genital and anal regions.
Right.
So you are dealing with this architectural change in highly sensitive tissue. In severe cases, this chronic inflammation leads to actual scarring and structural fusion.
Structural fusion, wow.
Yeah, the tissue can literally resorb and fuse together around the clitoris, the urethra, or the vaginal opening. The skin essentially turns into a scarred, thickened defensive shield.
Which I mean, brings up a cruel irony that is just everywhere in this clinical literature.
The paradox of the whole thing.
Right. The root of the problem, the immune misfire, is all the way down at the very bottom basement layer. But the condition itself makes the top layer of the skin unusually thick and tough and waxy.
Mm-hmm.
So if the skin is literally thickening and scarring into this defensive shield, how is any topical cream supposed to get down to that basement level to fix the busted pipe?
Well, what's fascinating here is that the medical community's response isn't just to use a standard cream. They use a very specific, highly potent weapon.
Okay.
The gold standard treatment across all the guidelines we looked at is a top-tier, ultra-strong topical corticosteroid called clobetasol propionate 0.05% ointment.
Now wait, I noticed you said ointment, not cream. The sources are very, very strict about that distinction.
Oh, extremely strict. And the chemistry behind it is vital for you to understand. Ointments are heavily preferred over creams for LS because of their base.
Because of what they're made of.
Right. Creams are water-based, which means they require alcohol and a whole host of preservatives just to keep bacteria from growing in the tube.
Oh, okay.
And when you apply alcohol and preservatives to highly sensitive, already inflamed, micro-torn genital tissues,
He's going to burn.
it burns terribly. Ointments, on the other hand, are oil-based. They're mostly petroleum jelly.
Oh, nice.
So they don't need those harsh preservatives, they don't sting, and they act as a heavy protective barrier that traps moisture.
Okay, that makes total sense. And we also need to clarify what this ointment is actually doing. Because I think a lot of people hear the word steroid and think of something that just, I don't know, numbs an itch.
Just a symptom reliever, yeah.
Right. But this isn't just a soothing lotion, is it?
No, not at all. It is fundamentally altering cellular behavior.
Wow.
A topical corticosteroid like clobetasol is an immune suppressor. When it absorbs into the skin, the steroid molecules actually enter the cells, travel to the nucleus, and literally turn off the specific genes that are producing the inflammatory proteins.
So it's rewriting the instructions.
Exactly. It acts like a tiny genetic programmer, shutting down that false attack signal in the basement layer.
Okay, so we have this superpowered gene-altering ointment. And the prescribed regimen the sources outline usually starts pretty aggressively.
Very aggressively.
You apply it every single night for a month to basically get the fryer under control. Then you taper down to every other night for the second month.
Right.
And by the third month, you're ideally using it just twice a week as maintenance. But then I hit a detail in the clinical instructions that honestly stopped me in my tracks.
The dosage amount.
Yes. Patients are explicitly told to use only a pea-sized amount, or what they call a single fingertip unit.
A tiny amount.
And that tiny pea-sized drop is supposed to cover the entire affected genital and anal area.
I know, it sounds totally counterintuitive. You have this massive, painful problem, and you're told to use a microscopic amount of medicine.
Exactly.
But with clobetasol, a little goes a very, very long way. Because it is so potent at turning off cellular activity, using too much of this steroid over a long period can actually cause the skin to stop regenerating properly.
Oh, wow.
Yeah, the collagen breaks down and the skin thins out dangerously, becoming like fragile tissue paper.
Yikes.
It's a side effect called atrophy. So the medical goal is to use the absolute minimum amount required to suppress the inflammation without destroying the healthy tissue.
Right.
To put it in perspective for you, a standard 30-gram tube of this ointment should last a patient 3 whole months.
Wait a minute. Let me play the skeptic for a second here, because this is the exact moment in the sources where things just stop making intuitive sense to me.
Okay, go for it.
We just established that the skin is abnormally thick. It's like wax paper. It's this hardened shield.
Right.
And the actual fire, the busted pipe, is buried deep in the basement layer. Now you tell me I can only use a single pea-sized drop of medicine to cover the whole area. How can we possibly guarantee that a tiny pea-sized amount of ointment penetrates that waterlogged, hardened drywall of a shield and actually reaches the target?
Well, that exact dilemma is why the medication alone will fail if you just slap it on.
Okay.
The chemistry of the steroid is totally useless without the mechanical preparation of the skin.
And here's where it gets really interesting, because this is where we introduce the secret weapon of today's deep dive, the soak and smear method.
The game changer.
Yes. If you just dab a pea-sized amount of ointment onto dry, thickened skin, it's just going to sit there on the surface doing absolutely nothing.
Exactly, just sitting there.
To make it work, you have to completely prep the canvas.
Okay.
So step 1 is the soak. You have to soak the affected area in plain, warm water for 15 to 20 minutes.
Yep.
And I have to say, the sources list some highly specific and, frankly, kind of amusing vessels you can use to achieve this.
Oh, they get very
They
creative.
do. They suggest a standard bathtub, a sitz bath, a kiddie pool, or, my personal favorite, a brand new clean cat litter box.
I mean, as amusing as the litter box sounds, it highlights the raw practicality of the advice, you know?
Whatever works.
You don't need expensive medical equipment. You literally just need a basin of warm water. And the physiological why behind this 20-minute soak is the linchpin of the entire treatment.
Okay, break that down for us.
So, the outermost layer of your skin, the stratum corneum, is essentially a wall of dead cells acting like bricks, surrounded by a mortar of natural fats.
Bricks and mortar, got it.
When you soak thickened skin in warm water for 15 to 20 minutes, the water physically enters those brick-like cells. The cells swell up, they soften that rigid, waxy shield, and the pathways between the cells literally open up.
Wow. So to go back to our analogy, if the clobetasol ointment is the plumber trying to fix the busted pipe in the basement,
Right.
the 20-minute warm water soak is the process of physically tearing out the hardened, waterlogged drywall so the plumber actually have a clear path down.
That's exactly what it's doing.
And the numbers on how effective this is are absolutely staggering. The dermatology sources note that applying topical corticosteroids to properly prepared, hydrated skin traps that water inside and can increase the amount of medication delivered into the tissue by 10 to 100 times.
100 times.
You are essentially turning that single pea-sized drop into a massive, highly targeted dose simply by hydrating the barrier first.
Exactly. You are literally changing the physical properties of the skin to pull the medication inward.
Now, obviously, sitting in a tub or a kiddie pool for 20 minutes every single night isn't always practical for everyone.
Right. Life gets in the way.
Exactly. If you're traveling or you just don't have a tub, the patient education webinars do offer alternatives. You can take a warm or hot shower, or if you can't even do that, you simply hold a warm, wet washcloth as a compress to the area for 10 to 15 minutes.
The key is sustained warm moisture.
Precisely. You absolutely have to unlock the door before you try to push the medicine through.
Yes, the prep is non-negotiable.
But once the door is unlocked, we move to the application phase. And while I was reading through this stack of sources, I found a glaring contradiction that I think a lot of people get tripped up on.
Oh, the drying instructions.
Yes, I really need you to explain this. When dermatologists talk about the soak and smear technique for general eczema, like say you have a patch on your arms or legs,
Right.
the instructions explicitly say do not dry off. They tell you to get out of the tub and smear the ointment directly onto dripping wet skin and then just immediately put on your pajamas.
Mm-hmm.
But these specific clinical instructions for lichen sclerosus say something totally different. They mandate that you dry off first. So why the mixed messaging?
It's an incredibly important distinction, actually, and it all comes down to the specific anatomy we are dealing with and the basic physics of oil and water.
Okay.
This is a critical nuance for you to understand, because LS involves the highly sensitive anatomical folds of the genital area, and because we're dealing with a highly potent steroid where dosage control is paramount, the protocol has to be modified.
Right.
After your 15 to 20-minute soak, you must gently pat dry.
Gently pat, so not like rigorously rubbing with a towel.
No, definitely not rubbing.
Yeah.
If you have literal drops or puddles of water sitting in the anatomical folds of the skin, that sitting water acts as a physical barrier.
Oh, because they repel each other.
Exactly. Remember, clobetasol is an oil-based ointment. Oil and water repel each other. If you try to smear the ointment over a puddle of surface water, the ointment will literally slide off and won't make contact with the tissue.
That makes perfect sense.
So, by gently tatting dry, you remove the surface puddles, but the skin cells themselves remain deeply hydrated, swollen, and porous from the soak.
Okay, that makes perfect physiological sense.
Mhm.
So you pat dry, clearing the surface, and then comes the final crucial step, the smear.
A smear, yeah.
And this isn't just a quick, careless dab. The sources are very clear that you have to really rub it in well.
Yes, you have to rear it in.
Depending on how much area is affected, you need to spend anywhere from 30 seconds to 2 full minutes, gently but firmly rubbing that pea-sized amount of ointment into the skin.
And that mechanical rubbing action is the final push. The warm water opened the pores, the ointment traps the moisture from escaping, and your sustained physical rubbing massages the active steroid molecules down through those softened upper layers.
So you're forcing it down.
You are physically driving the medication toward that basement layer where the inflammation is actually generated.
And there was a massive red flashing warning light
Huh?
in the sources right here during the rubbing phase.
Yes, there is. Under no circumstances should you scratch.
Right. The rubbing might feel really, really good, especially if the area is chronically itchy from the condition.
Which it often is.
But if you rub too hard, or if you use your fingernails and scratch the skin, you can trigger a secondary compounding nightmare.
It's a condition called lichen simplex chronicus.
Wow. Oh.
Yeah, it is essentially a chronic itch-scratch-itch cycle. When you violently scratch sensitive tissue, the nerve endings in the skin actually undergo a physical change. They become hypotrophic, meaning they get thicker and hyperreactive to the trauma.
So they get more sensitive.
Exactly. This makes the tissue itch infinitely more, which forces you to scratch more, which further thickens and damages the skin. You can actually develop lichen simplex chronicus right on top of your lichen sclerosus.
Well, that sounds awful.
You are essentially fighting two skin conditions at once, making the whole situation incredibly miserable. So rub firmly to deliver the medicine, but never, ever scratch.
Okay, so what does this all mean for the patient? We've soaked for 20 minutes, we've patted the surface dry, we've rubbed the pea-sized drop in for a full 120 seconds.
Yep, the whole routine.
Over a few weeks, the flare-up goes down, the fire in the basement is out. But LS is an incurable chronic condition.
Unfortunately, yes.
You don't just fix it and walk away forever. So how do you actually live with this condition day to day once the initial crisis is handled?
Well, if we connect this to the bigger picture, the management of LS requires a fundamental lifestyle shift. You have to actively baby this tissue for the rest of your life.
And the sources have a whole list of lifestyle mandates to prevent triggering the immune system again. Like, you need to wear breathable cotton or silk underwear.
Absolutely.
You absolutely must ditch regular, heavily fragranced bar soap and switch to emollient soap substitutes, things that clean the skin without stripping its natural oils.
Right. Very gentle.
Bubble baths are entirely out of the question forever.
And tight clothing, like tight jeans or activewear that causes friction, gone. Gone. Because mechanical friction and chemical irritants can easily reignite that immune response. And here is a vital piece of the pathology for you to remember. Even when the lichen sclerosus goes into remission,
Okay.
even when your skin looks totally normal, the architecture feels fine, and you have zero itching, the inflammation is still secretly smoldering down in that basement layer.
It's just waiting.
Exactly. The genetic misfire hasn't been cured, it's just being suppressed. That is why maintenance therapy is a lifelong commitment.
Right.
You might only need that pea-sized drop of clobetasol once or twice a week, but you have to keep doing it to prevent silent, painless scarring from creeping up on you over the years, which can happen completely unnoticed.
And speaking of daily maintenance, there is a very practical and honestly shocking safety warning in the NHS and Gateshead Health guidelines regarding the daily emollients.
Yes, the fire hazard.
Yes, a lot of patients use things like petroleum jelly, aquaphor, or paraffin-based creams throughout the day just to keep the skin moist, stop chafing, and protect the tissue from urine.
Very common practice.
But the guidelines issue a stark warning. If these paraffin-based emollients soak into your underwear, your pajamas, or your bed sheets over time, those fabrics become highly flammable.
It is a severe, life-threatening hazard that most people would just never see coming.
Wait, really? A fire hazard from moisturizer? The sources specifically warn patients not to smoke or go near naked flames like a gas stove or a fireplace.
It's completely true.
And to be clear on the mechanics of why this happens, the emollient itself won't just magically ignite on your skin. But when you wash your clothes, standard washing machines and detergents don't easily wash out heavy oil-based paraffin.
They just don't have the power to break it down.
Right. So over weeks and months, the microscopic oil residue builds up invisibly inside the fabric fibers. This drastically lowers the ignition temperature of the fabric, turning your pajamas or bed sheets into essentially a giant candle wick.
A giant candle wick.
That is a wild, dangerous side effect of simply moisturizing your skin.
It is, and it underscores how comprehensive your awareness needs to be when managing a chronic dermatological condition. Like, everything interacts.
Yeah, clearly.
Which raises an important question. Why are dermatologists so aggressively focused on lifelong maintenance and strict observation of this specific skin condition? It's not just about managing an itch or avoiding a fire hazard.
Right. It gets much more serious than comfort, doesn't it?
It does. The clinical guidelines from the British Association of Dermatologists outline a sobering statistic. Surveillance of LS is mandatory because patients with this condition have a 4 to 5% risk of developing squamous cell carcinoma, which is a type of skin cancer, in the affected genital area.
4 to 5%. I mean, when you're talking about cancer, that is not a negligible number.
It's really not. And the biology behind why this happens is crucial for you to grasp. It's directly tied to that smoldering fire in the basement layer.
How so?
Chronic, deep tissue inflammation forces the body into a constant state of tissue repair. Your cells are being forced to divide and replicate at an unnaturally high rate just to keep up with the damage.
Ah, I see where this is going.
Yeah. Whenever cell turnover is forced into overdrive like that for years on end, the statistical chance of a genetic mutation occurring during cell division skyrockets.
It's rushing.
Exactly. That unchecked mutation is what leads to squamous cell carcinoma. The inflammation acts as the catalyst. That is why you must remain vigilant even in remission.
So what should people look for?
If you ever notice persistent redness, new lumps, or an ulcer that just won't heal even after 14 days of using your steroid ointment, you cannot ignore it. You have to get back to your doctor immediately.
Okay, let's take a breath and recap this incredible journey through the sources. Lichen sclerosus is a deeply frustrating, deep tissue immune problem that we have to attack with a highly disciplined surface-level solution.
Perfectly said.
But by understanding the cellular mechanics of the skin, you can turn a tiny pea-sized amount of medication into a highly effective, life-changing weapon. It takes the 15 to 20-minute warm water soak to remove the hardened drywall of the skin and open the pores. It takes the gentle pat dry to clear the surface petals. And it takes the firm 120-second rub to physically drive the medication down to the basement layer to turn off those inflammatory genes.
That's the formula.
By doing that, you increase the effectiveness of the treatment by up to 100 times, you regain control of your physical comfort, and you protect yourself from long-term structural scarring and secondary cancer risks.
You know, it leaves us with a fascinating thought to ponder as we wrap up.
Oh, yeah.
We spend so much time and billions of dollars searching the horizon for the next miracle drug, the next complex chemical cure for our ailments. We constantly want a new pill to fix everything.
You always do.
But the soak and smear technique proves that sometimes the ultimate medical breakthrough isn't a new chemical at all. It's just knowing how to use warm water, basic physics, and 120 seconds of patience to unlock the full potential of the tools we already have in our medicine cabinets.
Wow.
It really makes you wonder how many other quote-unquote ineffective treatments or failed medications in our lives are actually perfectly good solutions, and we're simply applying them the wrong way.